Okay. Hi, everyone. Our debate topic is TeleABA versus in-home therapy. Our members and their roles are myself, Alexa Jones. I'll be the moderator as well as giving the introduction and conclusion. Jillian Park, who will be our stater and playing the part of pro TeleABA.
Hello.
Jennifer Hike, who will be our prover and will be interjecting with relevant research to back up the pro TeleABA side.
Hi.
And David Sober, who will be our attacker and playing the part of being against TeleABA.
Hello.
So to start out, I'll just give a brief history on what TeleABA is. So TeleABA is the delivery of ABA services utilizing technology that allows clients to receive ABA therapy when they may not have been able to otherwise. There are a large number of individuals with developmental disabilities who may benefit from ABA services. However, geographical limitations as well as other factors may make it difficult for these individuals to find available services in their area. The delivery of ABA services is a highly technical skill, and there are not always enough people trained in the field to keep up with the growing incidence of individuals with an ASD diagnosis. TeleABA allows a therapist to provide training, consultation, and support from one location to the client's location using technology such as webcams, microphones, etc. These services could be delivered directly to the client by the therapist, or the therapist could train the parents or caregivers to deliver these services, all while being able to observe the client's progress. Now that a background on TeleABA has been provided, we will debate some of the controversies surrounding this topic. We'll start off with the question, with what type of clients and in what situations would TeleABA be appropriate?
TeleABA is a service delivery model that can be used to provide behavior analytic services to individuals with limited access to properly trained professionals. This might include people who live in rural areas as well as people who generally just live in areas where there are limited to no BCBA service providers. A lot of the available research tends to focus on using TeleABA as a method for consulting with parents and using strategies derived from ABA, but it can also involve a BCBA or other related professional providing consultative services to both a parent or a direct care worker or even an ABA therapist.
According to Kaplan and Lidicott in 2008, TeleABA offers greater availability of services and access to healthcare providers, less time for patients and clinicians, and more timely data than in-home therapy. These advancements provide readily available and continuous care for clients and allow a ready flow of information between patients and providers, irrespective of their locations. Boisvert et al. In 2012 determined many individuals who may benefit from ABA services, including those with autism, reside in areas where public resources are scarce. Many individuals in need of therapy have a difficult time receiving services and accessing qualified professionals due to geographic limitations. According to Wacker et al. In 2013, lack of access to service providers often results in long delays in receiving needed services, families being forced to absorb significant costs to obtain services from out-of-state providers, or children going without the needed services. TeleABA allows individuals to access services regardless of their location, as it can be virtually accessed at any time from any location, and it can be utilized as an alternative to in-home therapy by a professional consultant.
Jen, a flaw that I find with parents or caregivers providing services that they may not have, or they may only have minimal experience with the field of applied behavior analysis and can implement, and they're responsible for implementing the intervention created and individualized by the BCBA. It could be a case where the parent might find previous and present successes in using only if-then contingencies, also known as bribing their kids to complete a task, a homework assignment, or any given SD while in their home environment. It would be difficult for a parent to correctly implement a treatment program when they could be completely unaware of certain conducts and principles that need to be followed when treating someone diagnosed with an autism spectrum disorder.
I think consultative services, both in traditional ABA service delivery as well as the TeleABA model, place an emphasis on ensuring that parents are well aware of the details of carrying out an intervention designed for a child. Because this newer and growing approach involves mainly a source of technology, the consultation consists of different features and qualities than consultation that's going to take place in the home or in a clinic. The primary aspect of TeleABA is generally in training the parents or caregivers on the principles of ABA. Through these parent trainings, parents are able to take control kind of at the helm of their child's intervention program, and they're going to be able to effectively carry out interventions to support their child. As professionals, we typically view the parent as the one who best knows the child's needs, and then they also spend the most time with their child in the natural environment. The natural role of parents as agents of intervention becomes pretty obvious when you consider all of this. Training should be geared toward ensuring that parents fully understand the various components of their child's intervention. While with TeleABA consultation, this element kind of takes center stage.
Findings by Vismara et al. In 2013 suggest that slideshows, videos, and exercises can be used within the consultation model to show that comprehension is sufficient among the consultees. This aspect is a benefit to TeleABA that other approaches typically do not possess. Home-based and clinic-based therapies often involve the parent observations of the therapist-client interactions with little to no knowledge of the principles or strategies being used. During the video-based consultation, parents are taught multiple ways to appropriately respond to everyday situations that are relevant to their unique situations. Professionals are able to train parents or caregivers in using multiple techniques for managing appropriate and inappropriate behaviors. Parents can also learn to use basic skills rooted in ABA that may support them in the home environment. While parent participation may be a concern by many of the parents of children with autism, parents being trained using TeleABA receive a high level of information on their children's program. This, in combination with meetings from the professional, provide a parent with more frequent suggestions, improvements, and training from the professional. The parent in the service delivery model is given greater control and insight into their child's intervention program.
With that being said, even parents, when they're trained in ABA, they would also need training and technology being used to consult with the BCBA and submit appropriate information when needed. Not everyone is familiar with computers as others, especially when it comes to using very specific programs to have video chats with another person, which is definitely going to be the case when consulting with the child's BCBA on a regular weekly basis. Not only is being familiar and fluent with the use of this technology needed when utilizing TeleABA, but it brings forth the point of the various equipment that is needed. For these services, parents must have access to not only a computer, but also a reliable internet source, because to have video chats, it is very important that you have a high-speed internet. And many areas of the country that are in rural townships lack the luxury of having high-speed internet available to them. These are just a few of the setbacks that I see and I'm concerned with that should be considered when using TeleABA.
You know, David, I think that's a really good point. Access to a computer or computer literacy skills are going to be a potential barrier to the service delivery model. Parents who use the service delivery model are going to have some basic computer competency skills, which may require a little bit of additional training before the actual service can start. With most of us being pretty well immersed in the digital world, you can easily leap to the fact that obtaining the equipment that's necessary for this delivery model might be costly. The additional benefit of our tech-savvy culture, however, is that many families already have access to most of the equipment needed for TeleABA. So before you kind of throw out the whole system, you might want to review the potential cost of training in computer literacy skills, as well as purchasing the necessary equipment, with the financial and the time cost to the individuals receiving the services in person or from traveling to a clinic.
In 2013, Wacker et al. Provided a cost comparison for conducting FAs via telehealth or in vivo. They estimated that the average weekly cost of delivering FA via telehealth to 20 participants was $58 per child, and the average weekly in-home cost per child would have been $335 with therapist travel time factored in. A similar comparison was made which estimated the average total cost for functional analyses plus functional communication training to be approximately $60 per visit for the 192 weekly visits, which resulted in a total cost of $11,500 for the telehealth group. Cost would have been approximately $291 per visit for treatment conducted in-home, and costs for 192 weekly therapy visits to homes would have totaled $55,872. To conduct in-home visits, consultants would have spent over 1,100 hours of drive time in addition to the time working with the families. The cost to set up a single video workstation was approximately $1,800, which covered teleconsultation equipment and software. The cost for behavioral treatment through telehealth was dramatically lower than for in-home behavior therapy.
Now, with parents implementing their own child's treatment, there is very likely going to be frequent cases of concerns of whether or not they're correctly or even effectively implementing the treatment. In the current clinic I work at, it does not have home-based interventions per se, but we still, nonetheless, it is common for parents to contact us and say that they're worried that things are not going as smoothly as effectively in carrying the clinic-based treatment over to the home as well as they have hoped. For example, one of our clients showed great success with learning and freely using the Picture Exchange Communication System, also known as PECS, after many months of training. However, we were really hesitant in carrying this skill over to the home environment just yet because of the mother expressed concern after reviewing what would be needed that she might not have the exact item readily available when they show her the sign, which is definitely still a critical part in learning the PECS in a new location, such as the home environment, and that had to be put off for a while. This, along with the frustration that a parent with more than one child to be given attention at one time, it will be a major inconvenience to ignore the child receiving treatment when the problem behavior is attention seeking, and ignoring the behavior is a part of the behavior intervention plan. Giving a child your undivided attention, as I mentioned, is a difficult task at times when you have more than one child. It could also be a case with the intervention lacking consistency when maybe a parent or a caregiver might lack the motivation on any given day or time during the day to fully carry out the specified protocols, reinforcing procedures, or punishment procedures that are put in place when appropriate. A clinician is not going to be present when utilizing TeleABA, so it is completely up to the independence of the parent to appropriately carry out and implement the treatment.
Yeah, David, I think this is another really good point that you've brought up. Parent buy-in is going to be critical to any successful ABA program. And again, I'm going to mention that it's going to be important to the success of a program where a therapist or a BCBA is implementing the program, that a parent's able to kind of follow through as well. The parent has to have the desire to participate in their child's programming to the degree necessary for the consultative services in TeleABA to be effective. And for TeleABA to be delivered effectively and for parents to feel comfortable with delivering these services, they're going to have to want some level of coaching, and they're going to have to be able to participate in regular training delivered by the consultant. Regular training and support may not always be realistic for all parents, and in that case, TeleABA just simply might not be the best option.
Vizmara et al. In 2013 found that parent training provided in the consultation of TeleABA gives an in-depth look into what is being implemented in the child's program and the research that supports it. Additionally, Carroll's study in 2010 mentions that in order for TeleABA to be delivered effectively and for parents to feel comfortable with delivering these services, parents must want to have some level of coaching or regular training from the professional consultant.
Yeah, and just to kind of follow up once more, I think it's important to remember that no matter what type of service delivery model you choose as a behavior analyst, you're going to have to get the parent on board. The parent is going to have to want to participate in some capacity. I think in TeleABA it's just a little bit more critical as a result of the model.
So up until this point, we have generally covered ethical and practical concerns related to who this service delivery model might be most appropriate for. As David's last point suggested, there are naturally arising concerns as to the efficacy of treatment delivered via TeleABA. Ethical Code 1.01, Reliance on Scientific Knowledge, states that behavior analysts must rely on scientifically derived knowledge based on science and behavior analysis when making scientific or professional judgments in human service provision or when engaging in scholarly or professional endeavors. Since BCBAs are bound by this ethical code, it raises the question, what type of services are supported by research through this service delivery model?
As Alexa just mentioned, behavior analysts are ethically bound to only practice in areas that are evidence-based. Research in this area is emerging, with the bulk of the relevant research having been conducted since roughly the year 2000. Several studies have, though, specifically reviewed the efficacy of this service delivery model in relation to common evidence-based interventions used by behavior analysts, including functional behavior assessments and functional communication training.
In a study by Wacker et al. In 2013, functional communication training, or FCT, was conducted by parents of 17 young children with autism spectrum disorders who displayed problem behavior. All procedures were conducted at regional clinics located an average of 15 miles from the families' homes. Parents received coaching via telehealth from behavior consultants who were located an average of 222 miles from the regional clinics. Parents first conducted functional analyses, or FAs, with telehealth and then conducted FCT that was matched to identified function of the problem behavior. FCT, conducted with a non-concurrent multiple baseline design, reduced problem behavior by an average of 93.5%. Here is a graph from the Wacker et al. 2013 study. This figure shows the results of 6 individual FCT treatments that were selected to show the treatment results for each function within a non-concurrent multiple baseline design. The treatment results obtained via telehealth were comparable to those obtained via the in vivo FCT treatments conducted in the children's homes in previous projects. For example, results from the in-home project by Wacker et al. In 2014 showed that an average reduction of problem behavior of 94.14% was achieved with the 12 children who completed treatment. The treatment was completed on average within 40 sessions, whereas the current telehealth study only required 16 sessions to reach the same criterion and reduce problem behavior by 93.5%. These data indicate that both the overall effects of treatment on problem behavior and the time needed to complete treatment were comparable. Results suggest that FA and FCT can be conducted by parents via telehealth with remote consultation from behavior consultants and appear to be highly efficient and effective treatments.
Jen, a major point that is raised and that comes to mind is whether TeleABA would then be appropriate for those individuals requiring immediate or intensive intervention. For example, a child with severe maladaptive, aggressive behaviors or self-injurious behaviors would potentially be delayed in being addressed due to the BCBA only meeting with the parent on a small number of weekly meetings. To be ethical, a proper assessment must be conducted to create and implement a behavior intervention plan, which is a frequently used ethical code 3.02. A functional behavior assessment is impossible sometimes to carry out without the BCBA's ability to monitor and manipulate everything in the environment in sometimes a moment's notice.
Yeah, this is another really important consideration when choosing to use TeleABA. Behavior that poses a risk to the safety of anyone involved might warrant face-to-face therapy with a trained professional. TeleABA, as we previously discussed, often requires a significant amount of time that's dedicated to training individualized and using recommended intervention procedures. You're not likely going to want to wait for a long, for a prolonged period of time to train a parent in a situation where the child's exhibiting severe problem behaviors like SIB or some other type of destructive behavior. If the problem behaviors being targeted are infrequent or severe, TeleABA might also not necessarily be the best solution for the delivery of these services. you have to consider on the flip side, like we talked about before, there might be instances where the child or their families wouldn't be able to obtain the services of a therapist at all, or that seeking available services would be very taxing on the family as a whole. In these instances, TeleABA might be the more viable option as opposed to no services at all. The certified professional in this situation is going to have to use his best judgment in determining if services provided via TeleABA are actually ethical within the particular circumstance. A behavior analyst may specifically want to refer to the BACB Compliance Code 2.09a when delivering services through TeleABA for severe behaviors to ensure that they're providing effective treatment for the client through this mode of service delivery. Compliance Code 2.03 is also particularly relevant here so far as ensuring that accepting a consultative relationship with the client in this scenario is going to actually benefit the client.
That's a good point, Jill, but a major factor that I consider as a potential drawback to TeleABA is, despite the treatment being evidence-based, which is clearly what applied behavior analysis revolves around, it would appear that it would be lacking a quality of care that others receiving different forms of therapy, such as home-based or clinic-based therapy, could benefit from. A parent could likely not have the full benefits of services that they can deliver as opposed to a therapist coming to the home could have. Not only training, but ensuring that all parts of the child's program is being followed.
Yeah, there is existing literature on this topic. A lot of the existing research has focused on efficient parent training. I'm going to turn it over to Jen to kind of discuss this topic and the literature in further detail.
In 2013, Seuss et al. Conducted an evaluation of fidelity with which parents of 3 children with autism conducted FCT in their homes. All training was provided to the parents via telehealth by a behavior consultant in a hospital setting. FCT trials coached by the behavior consultant were conducted during weekly 1-hour visits. Parents made video recordings of the treatment trials in which they conducted the procedures independent of coaching. The levels of fidelity during coached and independent trials were evaluated within a multi-element design and recorded parents' omission and commission errors during different components of the treatment over time. Here is a graph from Seuss et al. In 2013. The results showed no consistent differentiation between the coached and the independent trials. Some errors occurred more frequently overall, but none of the errors appeared to have a strong relationship with treatment outcomes. All children showed substantial reductions in problem behavior during the final treatment trials and especially during the coached trials. These results suggest that behavior analysts can use telehealth to implement FCT with acceptable fidelity and to achieve substantial reduction in problem behavior.
So, as the group has discussed, there are many ethical considerations that a behavior analyst must consider when delivering these services through TeleABA. We have to remember that this venue is one that is newly introduced, and as the history of ABA has shown us, we as behavior analysts must carefully apply our ethical codes within new territory. Our group stands for the continued growth of TeleABA with a distinct warning for any behavior analyst to apply caution and best judgment when working with clients through this modality. I would now like to open it up to Dr. Mudgall for any comments as this concludes our debate.
Perfect timing. I was just like thinking of things. You guys cited so many nice articles, and I think there's definitely no doubt that TeleABA can be effective in delivering treatment, and it's shown training parents, and it's also changing the behavior. Did you guys come across any research that talks about social validity or treatment acceptability when treatments were delivered just via TeleABA or in comparison to face services?
I couldn't specifically cite exactly what it said, but I do recall reading through with some of the articles where parents were asked like how they felt about it, and in general, I remember it saying that it was received positively by the parents involved. David, I don't know if you had something to say to add to that.
I kind of remember, like I said, I can't cite it either, but I do remember, if that's your only option in some parts, I mean, it's a great thing. So I mean, I don't think I've read anything where it's negative.
Yeah, well, and I think a lot of times one big problem for a lot of clinical cases that don't see the end is attrition, because a lot of parents cannot make treatment sessions due to a lot of issue, care for other children, uh, riding, getting a ride to the clinic or to the other setting. Obviously home-based is the most convenient to them. It's in their home, but sometimes it doesn't work out. So I think we don't have to be polarized in favor or against tele-ABA. I think if we can acknowledge that it is a good avenue and should be used only when direct service cannot be an option, or we can supplement. So we don't have to just use tele-ABA or just clinical. It could be that you do clinical, but 1 or 2 sessions could be, you can kind of merge in a tele-ABA session. And as David pointed out, if it is just not possible, there are so many locations where a behavior analyst, there's one per I don't know how many districts, and if that is the case, then it could be used. So I think if we just sort of be open to it, but not have it be the first treatment of choice, that's what my preference would be. I wouldn't feel doing any work with a client through and through tele-ABA unless I work with the kid. Whenever I implement a treatment, I need to try it out, be hands-on with it in the room with the parents, and provide feedback and show them how to do it. A lot of times I can't. I have to show the treatment on that client or on that kid for the parents or the treatment agents to be able to see how to do it. I can't hold the fake doll and say, well, now you're going to sit like this, or now you're going to praise like that. For certain things, it has to be live, real, using the actual client feedback. And for going over things, even if you're just reviewing treatment plan, if you're just going over data, certain things could be achieved, and could possibly be cost effective, and more convenient if distance is one issue. So I think and I think, as you pointed out, Jillian, about the various ethical codes, one thing to also keep in mind is making sure all that is protected. So if you're doing tele-ABA, it's probably going to be used through some network exchange, so making sure the client information is protected, and there are no other networks or if you're going to do through Wi-Fi or whatever, nothing, and like the client confidentiality is protected. So yeah, I think it's like most of the topics we have discussed, there is no right or wrong. It's just a matter of understanding that either side that we are on, there are ethical challenges, there are real practical challenges, and then you just have to sort of be open-minded and not be polarized in either direction, and just figure out what is the best solution for the situation at the time, and best ultimately looking out for your client, and remembering do no harm. So that's my input for this topic.